Hello friends, and welcome back to our channel. This video will examine the terrible facts about dementia and the significant effects it has on both the afflicted and their loved ones. Dementia, a word that fills many people with terror. It goes beyond simple carelessness. It's a terrible illness that robs us of our identities, memories, and core selves. Dementia is a debilitating illness that impacts millions of people globally. This video uses scientific ideas to examine the horrifying elements of dementia. Understanding dementia. The term dementia refers to a broad category of neurological disorders that impact the brain. Alzheimer's disease is the most prevalent kind, although there are also other kinds, including frontotemporal, Lewy body, and vascular dementia. These illnesses result in a reduction in cognitive function, which impacts thinking, memory, language, and daily functioning. Brain cell destruction leads to dementia. Damage to the brain impairs the communication between brain cells, which results in behavioral and cognitive alterations. As a progressive condition, it deteriorates with time. A reduction in mental capacity that causes problems in day-to-day functioning is referred to as dementia. Although there is an increased risk with age, it is not a typical aspect of aging. Dementia comes in numerous forms, the most prevalent of which is Alzheimer's disease. Dementia progresses gradually but relentlessly. Imagine losing the capacity to identify people you love, forgetting how to do simple chores, or becoming lost in your own house. In the early stages, dementia can be subtle. It might start with occasional forgetfulness or confusion. Loved ones may notice these changes, but they can often be mistaken for normal aging. However, these early signs are just the beginning of a much darker journey. The middle stages. The signs and symptoms of dementia worsen with time. Individuals may have severe mood fluctuations, have trouble identifying friends and relatives, and become confused in familiar surroundings. This phase is especially upsetting for the person experiencing it as well as their caregivers. It hurts so bad to see a loved one go away. It's as if they are mourning a living person. They transform into someone else entirely. There is a tremendous psychological and physical toll on caretakers. A word of caution. Remember, this video is for informational purposes only. If you have concerns, talk to your doctor. They can advise you on the best screening methods for your individual situation, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. The late stage. People with advanced dementia become incapable of speaking, controlling their body's processes, and carrying out daily activities like eating and taking a shower. They need care around the clock. A husk of the person they used to be has taken the place of the person they once were. This stage is a financial, emotional, and psychological burden in addition to a physical one. Making difficult decisions regarding end-of-life care and preparations is a common experience for families. The horror. Dementia is terrifying for reasons beyond its physical decline. It's the exasperation of being confined to a collapsing mind and the sense of losing control. Witnessing this decline can be equally awful for caregivers. Witnessing the gradual disappearance of someone you love is devastating. The gradual loss of self. A person with dementia gradually loses their personality, memories, and capacity for independent living. We'll look at how patients and their loved ones experience extreme dread and uncertainty as a result of this progressive loss of identity. The world becomes alien. Familiar persons and surroundings may become unrecognizable as dementia progresses. We'll talk about how this disorienting foreign landscape that replaces reality adds to the terror that dementia sufferers feel. Familiar persons and surroundings may become unrecognizable as dementia progresses. We'll talk about how this disorienting foreign landscape that replaces reality adds to the terror that dementia sufferers feel. Trapped in a failing mind, many dementia patients experience moments of lucidity where they're acutely aware of their declining mental state. This terrifying realization of being trapped in a deteriorating mind adds another layer of psychological horror to the condition. The impact on families and society. Individuals with dementia are not the only ones affected. Entire families and society are also impacted. In addition to the enormous financial expense, there is a great deal of emotional strain. The annual expense of dementia care surpasses $290 billion in the United States alone. Families require financial and emotional support. There are resources out there, but finding your way around them might be difficult. Asking for assistance is essential. Caregivers shouldn't try to handle everything on their own. Living with dementia, although dementia cannot be cured, there are therapies that can help control symptoms and halt the disease's progression. The diagnosis must be made early. See a doctor as soon as possible if you or a loved one exhibits dementia-related symptoms. Hope and research. There is hope despite the terrifying nature of dementia. Research breakthroughs are helping us get a better understanding of the problems and potential solutions. Worldwide organizations are committed to increasing awareness and providing support to those impacted. While dealing with dementia might be frightening, no one needs to go through it alone. In the fight against this illness, awareness, research, and support are essential. When we work together, we can change things and give those who are suffering from dementia hope. Get in touch with neighborhood organizations and support groups if you or a loved one is suffering from dementia. Teach others and yourself. We can defeat the horror of dementia together. Even though dementia is obviously terrible, it's important to address the subject with compassion and understanding. We may endeavor to improve support for individuals impacted by this condition by increasing awareness. If you found this video helpful, give it a thumbs up, share it with someone who might benefit, and comment down below with any questions or topics you'd like us to cover in the future. Thanks for tuning in, and I'll see you in the next video.